A new dawn, Uganda's largest malaria vaccine deployment. Uganda has taken a monumental step forward in the fight against malaria. In April 2025, the country launched its national malaria vaccine program. This marks a significant milestone as Uganda becomes the 19th country in the world to implement this life-saving intervention. This ambitious endeavor represents the largest rollout of the malaria vaccine to date, signifying Uganda's unwavering dedication to protecting its citizens, particularly the most vulnerable. Uganda received a substantial shipment of 2.278 million doses of the malaria vaccine in early March 2025. These doses are being distributed strategically across the nation. The deployment prioritizes districts with moderate to high malaria transmission rates, ensuring that those most at risk are provided with this crucial protection. This targeted approach aims to maximize the impact of the vaccine and safeguard the health of those who need it most. The introduction of the malaria vaccine in Uganda is a beacon of hope. It signifies a turning point in the battle against this deadly disease. The commitment shown by the Ugandan government in partnership with international organizations demonstrates the power of collective action. This landmark initiative sets a precedent for other nations to follow suit, bolstering global efforts to eradicate malaria and create a healthier future for all. The malaria burden, a heavy toll on Uganda. Malaria's grip on Uganda has been relentless, casting a long shadow over the nation's health and prosperity. The statistics paint a stark picture of the disease's devastating impact. In 2023 alone, Uganda reported a staggering 12.6 million cases of malaria. This alarming figure underscores the immense burden that malaria places on the Ugandan healthcare system and the population as a whole. The human cost of malaria is immeasurable, with each life lost representing a tragedy for families and communities. In 2023, it is estimated that over 15,945 lives were tragically cut short due to malaria in Uganda. These heartbreaking figures serve as a stark reminder of the urgency to combat this preventable disease. Behind the statistics are countless stories of grief, loss, and shattered dreams. Beyond the immense human suffering, malaria also exacts a hefty economic toll on Uganda. The economic impact of malaria in Uganda surpasses $500 million annually. This financial burden encompasses healthcare expenses, lost productivity, and the strain on the nation's overall development. The cost of treatment, including hospitalization and medication, places a significant strain on families and the healthcare system. Climate change fueling the malaria fire. The fight against malaria is further complicated by the looming threat of climate change. Rising global temperatures create more favorable conditions for mosquitoes to thrive, leading to an expansion of their populations and geographic ranges. This expansion of mosquito habitats means that malaria-carrying mosquitoes are now reaching higher altitudes and new regions, exposing previously unaffected populations to the disease. The impact of climate change on malaria transmission is already evident in some parts of the world. In the Ethiopian highlands, for instance, malaria zones have expanded to higher elevations as temperatures rise, posing a new threat to communities that were once considered safe from the disease. Similar range expansions for mosquito species are predicted in the Americas, highlighting the global reach of this climate-driven health challenge. Addressing climate change is not just an environmental imperative, but also a crucial component of malaria control efforts. International collaboration is essential to reduce greenhouse gas emissions and mitigate the impacts of climate change on human health. By working together to address the root causes of climate change, we can create a healthier and more sustainable future for all. United we stand, a call for global collaboration. Combating malaria requires a multifaceted approach that goes beyond just medical interventions. It demands a united front, bringing together cultural leaders, health officials and communities in a shared commitment to eradicating this deadly disease. Dr. Richard Kabanda, a renowned Ugandan public health specialist, has emphasized the indispensable role of collaboration in the fight against malaria. Cultural leaders, with their deep understanding of local customs and traditions, play a vital role in promoting health education and encouraging the adoption of preventative measures. Their influence within communities is invaluable in disseminating accurate information about malaria and mobilizing individuals to take action. By working hand in hand with health officials, cultural leaders can bridge the gap between scientific knowledge and community practices, fostering a collective sense of responsibility for malaria prevention. Community engagement is paramount in the fight against malaria. When communities are empowered with the knowledge and resources to protect themselves, they become active participants in disease prevention. Educating communities about the importance of mosquito nets, indoor residual spraying, and seeking prompt treatment is crucial. By fostering a sense of ownership and responsibility, we can create a sustainable and community-driven approach to malaria control.